to thrive. My name is Yann Iliaker. I'm an advocacy coordinator at Global Health Advocates, and I will moderate today's conversation. Over 250 people have registered to join today. Thank you for your interest and your own mobilization on the issue of integration of nutrition and immunization, or I&I in short. Global Health Advocates is a French NGO based in Paris and Brussels, advocating for health equity. With worldwide partners from the Action Global Health Advocacy Partnership, we ensure policies and resources effectively address health inequalities. We encourage political will and engagement on the sectors of nutrition and vaccination, including ahead of critical moments like the Nutrition for Growth Summit or the Gavi Replenishment Conference. The discussion of today will be followed by a Q&A session. Don't hesitate to interact with us by commenting or asking questions through the chat below the video. For our Francophone listeners, translation is available with subtitles. Just switch the page language by clicking on the flag at the top right corner of the web page. Before introducing you to the panelists of today's conversation, I'm grateful to hand it over to Mr. Thani Mohamed Swalihi, French Minister for Francophonie and International Partnership, who recorded a video to open today's discussion.
Mesdames, Messieurs, je suis très heureux d'introduire ce webinaire relatif à l'innovation par l'intégration des combats pour la nutrition et l'immunisation. Je remercie Action Santé Mondiale pour cette initiative qui contribue à la mobilisation pour le sommet Nutrition pour la croissance que la France accueillera ce mois-ci. Nous savons aujourd'hui que les interactions entre nutrition et vaccination sont nombreuses. Les enfants qui souffrent de malnutrition sont plus vulnérables face aux maladies infectieuses et ont davantage besoin de la protection des vaccins. Des enfants mieux nourris développent aussi des réponses immunitaires plus fortes, maximisant ainsi les bénéfices des vaccins. Par ailleurs, les interventions de vaccination et de nutrition ciblent souvent les mêmes populations vulnérables situées dans des zones de conflit et de fragilité. Il y a donc un véritable enjeu à intégrer les interventions de nutrition et de vaccination afin de mettre de ces programmes et sauver davantage de vies. Pour ce faire, il est essentiel de renforcer les systèmes de santé dans leur ensemble. Ces interventions doivent aller au-delà de l'achat et de la livraison de vaccins et de produits de traitement de la malnutrition. Il nous faut une approche plus globale et préventive qui intègre les enjeux de formation, de dépistage et de sensibilisation des populations. Plusieurs partenariats ont émergé ces dernières années, notamment grâce à des acteurs comme Gavi, le mouvement Scalping Up Nutrition et la fondation Eleanor Crook. Alors que la pandémie de Covid-19 a vu une augmentation du nombre d'enfants dits zéro dose, que les conflits se multiplient et que le nombre d'épidémies augmente, il devient urgent d'évaluer ces partenariats innovants. 2025 est une année charnière pour la nutrition et la santé mondiale. Je cite notamment N4G Paris, que la France accueillera les 27 et 28 mars prochains, 4 ans après l'édition très réussie de Tokyo. Nous avons lancé une mobilisation internationale pour que chacun prépare et enregistre ses engagements pour le sommet sur une plateforme dédiée. Nous exhortons vivement les décideurs à améliorer l'intégration de la nutrition dans toutes les politiques. Le webinaire d'aujourd'hui s'inscrit dans la préparation de ces grandes échéances. C'est pourquoi je me réjouis de votre participation et je souhaite que cette discussion contribue à identifier des actions concrètes. Vous pouvez compter sur la forte mobilisation de la France à cet égard. Je vous remercie.
Thank you to the Minister for Francophonie and International Partnerships for this introduction. France is at the forefront of these two essential fights. Having hosted the Forum for Vaccinal Innovation and Sovereignty last June, where Gavi presented its investment opportunity, and the Nutrition for Growth Summit at the end of this month, we hope that in terms of commitments, France will also show the way in 2025, as it will be a decisive year for both nutrition and immunization. As in 2022, with the latest data available, 14 million children still never received any routine vaccine. 148 million children were still affected by stunting, and 45 million children were still affected by wasting. The world needs to increase its effort to halt these tragedies, where from birth and during the first years of life, too many people don't have the same access to their right to grow healthy. With the Nutrition for Growth Summit at the end of the month and the upcoming Gavi Replenishment Conference, the global community must stand out against this situation and bring solutions to address malnutrition and extend the vaccine coverage. Integration represents an opportunity in this regard. With our distinguished panelists today, we'll now explore pathways that decision makers, policies implementers, and solidarity actors could embrace integration to advance both nutrition and immunization. I'm happy to welcome our panelists and thank them for joining us. Today, we'll be joined by Dr. Rebecca Grais, Executive Director of the Institut Pasteur Network, Mr. Ramadhani Noor, Nutrition Manager at UNICEF Ethiopia, Mr. Augustin Flory, Managing Director for Innovative Partnership and Development Finance at Gavi, the Vaccine Alliance, Ms. Yashodhara Rana, Director of Policy and Research at the Eleanor Crook Foundation, and Ms. Maria Kahema, Midwife at the Tumbi Regional Referral Hospital in the region of Kibaha, Pwani of Tanzania. I will start with you, Dr. Grais. You are the Executive Director of the Pasteur Network. Prior to this position, you served as the Director of Research at Epicenter, the research branch of Médecins Sans Frontières. For years now, you are particularly known for your publications and engagement on vaccine development and epidemiologic studies among vulnerable populations. Could you share with us your scientific perspective about the connection between infectious disease and malnutrition and why it is important to address them jointly?
Sure, thank you. And I want to thank everybody for inviting me to participate in this webinar. So I have the task of explaining a bit of the background or the science around this. So the best way to do that is if we imagine a mother and she's in a remote village and she's holding her child in her arms, and her baby has been sick for weeks, struggling with diarrhea and fever. And she's doing everything she can, feeding him small spoonfuls of porridge, offering water, but nothing really seems to help. And with each passing day, her baby grows weaker, and the sickness is taking away his strength, and the hunger is taking away his defenses. And this isn't just her story. This is the story of the millions of children every day, of mothers and their families and children around the world suffering from this. And what she's experiencing and her baby is experiencing is this vicious cycle between infection and malnutrition. It's really a deadly loop where poor nutrition weakens the immune system, making children more vulnerable to infections and making infections further worsen their nutrition, trapping them in this downward spiral. And so when we don't break this cycle, children don't just suffer in the short term, they face long-term consequences, including stunted growth, cognitive delays, and higher risks of chronic diseases when they're adults. And so the question is, why does this happen? What does science tell us about this? And where is it that we still need some answers? So the body, to fight infections, it needs fuel. Without enough calories, proteins, vitamins, minerals, the immune system doesn't function properly. And this leaves a malnourished child essentially defenseless against even minor illnesses. And so the science says here that malnourished children have fewer white blood cells, which are the body's main defense against bacteria and viruses. Zinc, iron, vitamin A deficiencies are especially dangerous because they impair the production of antibodies. These are the proteins that help fight infections. And the gut, which actually contains, I think the estimate is 70% of the immune system, becomes damaged in malnourished children. And this makes it easier for harmful bacteria to enter the body. So if everybody imagines the immune system as an army, this is the analogy that's used in medical schools all over the world. When a child is well nourished, the army itself is strong, well fed, and ready to fight. But in malnutrition, those army soldiers are weak, slow, poorly equipped. And the result is that children become more vulnerable to infections like pneumonia, tuberculosis, and measles. And I'd just like to point out that pneumonia and measles, those are both vaccine-preventable diseases, and to some degree, even tuberculosis. And some of those illnesses might be ones that a healthy child can recover from, but can be deadly for a malnourished child. So one of the best examples of this, just to give you an idea of the magnitude, is the nutritional crisis in the Sahel in 2005. And during the best estimates there were that about 20% of all children living in the Sahel were considered severely acutely malnourished. So if we go back to that vicious cycle and we flip it around the other way, what happens when a child gets sick first? What's the relationship there? Well, every infection steals nutrients from the body. You remember the immune system needs to be fed. So when a child has a fever, their metabolism speeds up, burning more energy. When they have diarrhea, they lose fluids and minerals. You all know this. And many infections even cause lack of appetite, which makes it even harder for a child to eat. So in terms of the science here, chronic infections like repeated episodes of diarrhea or intestinal worms, what happens is they damage the gut lining, making it harder for the child to absorb nutrients, even if the child eats enough food. Or malaria, which affects millions of children, destroys red blood cells, and that can lead to severe anemia and further weakness. HIV is an example, not only weakens the immune system, but increases the body's energy needs, making malnutrition even worse. You need even more to fight it off. And so this is why some children, even when they're in food-secure environments, remain malnourished. They're trapped in a cycle where infections prevent them from gaining weight and developing properly. If you take the case even of HIV-positive mothers, for example, many are undernourished themselves. And when they contract infections, their bodies struggle even more, making it harder for them to breastfeed or to recover after childbirth. Their newborns start life already disadvantaged, and both of them are then at risk for both malnutrition and infections. But so what can we do moving forward, and how does science play a role? Well, one of the most exciting areas of research today in this area is the microbiome. So that's the trillions of bacteria living in our gut. And these bacteria play a crucial role both in nutrition and immunity. And there's some new evidence which suggests that they may hold the key to breaking this cycle. So healthy gut bacteria help digest food, produce vitamins, and fight off harmful pathogens. What happens in malnourished children is their gut, the gut microbiome, is severely altered. And this can sometimes lead to what's called a leaky gut. And that means where harmful bacteria enter the bloodstream and cause inflammation. So there's some studies today that suggest that rebuilding that gut microbiome, that can be through probiotics, prebiotics, fecal microbiota transplants even, all of these things and some things which we haven't even discovered could help improve nutritional outcomes and immune function in malnourished children. So that area of research is still young, but it could revolutionize how we treat malnutrition and prevent it by not just feeding children, but also by healing their gut bacteria. But despite everything that we know and what I mentioned, there's still some big questions which remain about this vicious cycle. Why do some malnourished children survive repeated infections while others don't? Scientists are looking at genetic factors, gut bacteria, immune responses to try and understand that. Can we create better nutritional therapies or preventive mechanisms? So many of you are aware of things like ready-to-use therapeutic food or ready-to-use foods, and those can save lives, but maybe adding a microbiome-based component of that could also help to restore the immune system of those children. How's climate change and food insecurity making everything worse? Droughts and conflicts, as the minister mentioned, are particularly locations where children are the most vulnerable. There's a disruption in supplies and an extreme difficulty often to access care. But I think it's also important to mention that some of the good news is that there's some examples where this cycle has been broken. So countries and locations or communities that are investing in nutritional programs, along with vaccination programs, have made remarkable progress. So doing them both at the same time. And those have led to much better outcomes in both child mortality and statistics on malnutrition. But we do need to go even further than we have, which is we need some solutions that address not just food shortages, but also infections. We also need to address the immune system, the immune health of these children, and the microbiome. At the end of the day, no child should die simply because they were too weak to fight off an infection or too sick to absorb the food they eat. We're in 2025. And if we act now through research, policy changes, community programs, and all of the work that all of our speakers are doing, we can save lives, empower mothers, and give every child a chance to grow strong and healthy. So our next speakers are looking at how and what are some of the examples of how we break this cycle. Thank you.
Thank you very much, Rebecca, for this call, and to remind us that it's important to remain evidence-driven, especially when science is under attack. We'll now pursue with you, Mr. Ramadhani Noor. You are the nutrition manager with the UNICEF Ethiopia country's office, and have previously worked with UNICEF Tanzania. Your work focuses on designing and implementing large-scale programs in the areas of nutrition and system strengthening, especially in low-resource settings. Which impact did you observe on the health of population when integrating nutrition and immunization interventions in UNICEF's program in Ethiopia?
So thank you very much. So I will probably spend about 3.5 minutes to just narrate a bit the program we're implementing in Ethiopia, and then we have an opportunity to have the video that will give you a bit more insight on what's happening on the ground. So as you know, despite ongoing efforts by the ministry and partners in Ethiopia today continues to face unacceptably high rates of zero-dose children, with significant numbers missing out essential interventions like pentavalent vaccines, nutrition, but also measles protection. Ethiopia is estimated to have over 16 million children who are under 5, but it ranks the second in the number of zero-dose children and third in the number of children unprotected against measles today, with an estimated 1.1 million and 1.7 million children respectively missing out on these crucial first doses. Meanwhile, at the same time in Ethiopia, we have a range of estimated about 800,000 to 1.2 million children who continue to need malnutrition treatment. Wasting, as you know, costs Ethiopian government a lot of resources. It estimated to cost Ethiopia around 150 to 230 million annually. So based on this, the government of Ethiopia came up with this really excellent innovation through the Sakota program and the call to support the Ministry of Health to support the Nutrition Immunization Nexus program, which aims at improving immunization, prevent malnutrition, and reduce child mortality. So the question is, why the Nexus approach? Increasingly, we recognize the zero-dose communities. In those communities, children do not only miss the vaccines or immunizations alone, but also they do tend to miss out other services, including nutrition. Hence, there's a need for a child-centered approach, recognizing the interconnectedness of the children needs, but also a truly effective approach requires an integrated program design and implementation that consider these interconnected factors. For example, providing nutrition services to a child while neglecting their immunization needs or exposure to waterborne illnesses is counterproductive in that sense. Even more crucial, thinking on sustainability, especially with limited resources and increasing needs due to context. For example, in Ethiopia, we have huge population, which is pastoralist communities, but also population that is affected by drought, conflict, internal displacement, which make it increasingly challenging and costly to meet the needs of the hard-to-reach population. So when you reach out to those children, it's very, very important to address all the needs that they have at some point, immunization, be it immunization or nutrition. So how does this immunization nutrition nexus works in Ethiopia? So initially, the Minister of Health had recognized the need to integrate the two. And initially, when we started by having the annual campaign. Whenever we had annual campaigns for measles, we would also integrate the nutrition activities into it. However, going forward, there's a need to be a bit more systematic and have it even more integration and in terms of programming itself, be it in nutrition programming or immunization programming. And thanks for the joint sort of match funding that we received from CIF and Gavi, totaling about 13 million. It presents us with an opportunity for a multi-sector initiative that can reach out these zero-dose children and communities in Ethiopia. Currently, as we speak, there is an ongoing demonstration program that is rolled out across 50 wards or 50 districts, where we integrate immunization, nutrition, but also birth registration and other child services. In these wards where nutrition programming is stronger established, then we use nutrition programming as an entry point for immunization to reach out the zero-dose children, and vice versa, where you have the EPI program or immunization program, then we use it also to deliver the nutrition services. This initiative aims to reach the most vulnerable children in underserved population particularly, and these are the internal displacement populations in the urban poor, the pastoralist, with these essential services that they need, including vaccination and nutrition. The current program, we target to screen over 1 million children, and we plan also to deliver vitamin A supplementation to those children, but also be able to treat the high-risk, moderate, acutely malnourished children, around 300,000, providing preventive commodities like SQLNS to almost around 300,000, but also reach out over 600,000 zero-dose children for immunization. Our vision is that this joint immunization nutrition nexus programming informs the Ministry of Health and the government of Ethiopia ambition to optimize the primary health care system. And already UNICEF Ethiopia is supporting the ministry to design an optimized primary healthcare system, which is informed with the experiences that we have picked up from the joint immunization and nutrition program that CIF Gavi is supporting. With that program, we aim to integrate a more broader child nutrition services, but more as address the what we call the vital organs of the primary healthcare system, is including the financing, the human resource, and so forth, to be able to bring in efficiency at that level in delivering these integrated services. So just to conclude, I would like to say that the needs in Ethiopia remain huge. Therefore, collectively, to address these challenges, we need to do things differently. There is, in our case, we're building a case to say there's no value in saving a child from measles and let the child die from malnutrition, and vice versa. So equally, we cannot celebrate increasing coverage of immunization and nutrition and remain with children who are not accounted for example, with birth registration, or grow up in increasing poverty where they could not access clean water or good wash standards. It is therefore equally important for us to address the context of the child mortality preventions with sustainable focus. So let me take this opportunity again to express my sincere thanks to Gavi, CIF, other donors through Child Nutrition Fund, including the Eleanor Crook Foundation, for their generous contribution, as much funding to this initiative, and to all other development partners for their close partnership and support. So I'll probably request that we take 1 minute or so to look at the video, which will give you a bit more insight on how this program is implemented on the ground. Thank you.
Thank you, Ramadhani. Your operational perspective demonstrates how the immunization and nutrition nexus recognizes the interconnection of children's needs, and none of those needs should be prioritized over another. And we'll now play the video for illustration.
ስሜ ዳውድ አሊ ምራህ ይባላለሁ ከማሙለ ጤና ኬላ እዚህ አሁን ዜሮ ዶዝ የተገኘው ከቦታ ቦታ ስለሚንቀሳቀሱ ጤና ኬላ ሩቅ በመሆናቸው ሰላም አለይኩም
ወአለይኩም ሰላም
በሴብና በጋቢ ድጋፍ ቤት ለቤት እየሄድ ዜሮ ዶዝ ክትባት ሰጥተናል። ቤት ለቤት እየሄድ ዘምረን ቫይታሚን ኤ ዲወርሚንግ ስክሪኒንግ በርድ ሰርተፊኬት ሰጥተናል። እነሱ ድጋፍ
dumakadu kitibat geek masuginoy makena edegena hedebena geek masuginoy saku kitibat geene ያው ለኔ የሚጠቅመው ህፃናት ከሞት ድነው ከበሽታም ድነው ማየት ለኔ በጣም ፎይሳ ይሰጣኛል። የኔም ልጆቹም ስላሉ በጣም ደስ ይለኛል። kitibat kadu rufanihi urifana kadu afiyat edegeni
Well, what a perfect transition to go over to you, Augustin Flory. You're the managing director at Gavi, the Vaccine Alliance, overseeing the Gavi's portfolio on development and innovative finance, private sector partnership, and innovation. You've also previously held strategic position in several organizations mobilized in the fight against malnutrition, like the Scaling Up Nutrition Movement, the Results for Development Institute, the Children Investment Fund Foundation, and Power for Nutrition. Given your expertise in both sectors, could you explain how immunization stakeholders like Gavi are contributing to improving child health through nutrition also?
Thank you so much, Jan, and good morning, good afternoon, good evening, everyone. It's a pleasure for me to be here, given my background in the nutrition space and my new family in the immunization space. I have two families now. I haven't switched family, and so it's wonderful. The project in Ethiopia that we just heard about and we saw this wonderful video demonstrates the transformative impact of integrating services, impacts on health systems, on communities, on families, and ultimately on the child who benefits from these life-saving interventions. Let me maybe start with a few words about Gavi. So Gavi is a global health public-private partnership dedicated to increasing equitable access to vaccines. Gavi has vaccinated more than 1.1 billion children and saved close to 19 million lives since its creation 25 years ago. This is our anniversary year. And Gavi draws on the strength of its partners in alliance. So it's the leadership of countries like the government of Ethiopia, funding from donors, the technical expertise of the development community, UNICEF, the World Bank, and the business know-how of the pharma industry and the private sector. Our upcoming 5-year strategic period is designed to double the pace of our impact. So what we want to do is to reach the next billion children in half of the time. So protecting 500 million children in the next 5 years and saving 8 to 9 million lives. And as we heard from the previous speakers, vaccines trigger the strongest immunity in children when they are well nourished and have been receiving adequate diets. And children who are unvaccinated are more susceptible to catch infectious diseases and become malnourished. And globally, more than 14 million children, are unvaccinated or under-vaccinated. And there's a lot of overlap between the zero-dose children and the malnourished children. And unfortunately, both the numbers, zero-dose and malnourished children, kind of have been growing in the past couple of years since the pandemic. So at Gavi, we recognize that tackling these inequities requires an approach that strengthens health systems and ensures that every child receives all the care they deserve. An approach that puts mothers and their children at the center and that integrates immunization and nutrition at the center of primary care, working alongside new and existing partners in the spirit of the Lusaka agenda. And as the Vaccine Alliance, Gavi is uniquely placed to support the integration of immunization and nutrition. Our close partnerships with our alliance members, such as the one we just heard about from UNICEF, enables us to bridge across sectors effectively. Our operating model of working directly with governments gives ministries, health workers, and communities full ownership and secures long-term sustainability of programs. So one of the funding levers that has enabled us to do this is the Gavi Matching Fund. This is an innovative funding mechanism that helps leverage philanthropic and other private sector contributions to drive innovation and generate learnings from new operating and implementation models. So the Matching Fund is currently supported by FCDO, the Gates Foundation, and the Netherlands, has made significant investments in immunization nutrition integration programs in countries with the highest burden of malnutrition and under-immunization, and these are Ethiopia, Nigeria, and Pakistan. In these countries, the Matching Fund has doubled the funding of philanthropic partners, so including the Eleanor Crook Foundation, the Children Investment Fund Foundation, SIF, the Aga Khan Foundation, and the Power of Nutrition, to test and scale innovative approaches for integrating immunization and nutrition services. These partnerships are crucial in finding the new ways that we need to reach missed communities and zero-dose children, to generate demand for both services and to document what are the efficiencies of leveraging social protection, health, and community platforms, especially in the hardest to reach areas. The last mile is the most expensive and challenging to serve, and yet these are the areas where the highest burden of disease and malnutrition do exist. So the Nutrition for Growth Summit will allow countries already implementing these approaches to share their experiences and challenges and foster comprehensive dialogue and collaboration. And together with our partners, we will be highlighting key solutions at the summit at the end of this month. But there's high demand in Gavi countries for more support for immunization nutrition integration. And to continue this crucial work during our next strategic period, we need investment from our donors, and we need sustained collaboration across global health and nutrition stakeholders. So delivering on the ambitious goals of our next 5-year period and building a safer, stronger, more prosperous world depend on securing investments now. So we call on all our partners to step up and invest in this critical mission, and invest in a successful Gavi replenishment, and invest and provide us with the additional resources we need to accelerate the immunization nutrition integration agenda. Thank you very much.
Thank you very much, Augustin. Indeed, we know that strengthening cross-cutting approaches, maintaining and reinforcing coordination among technical and funding partners and better aligning it with national strategies will be key, but that will require funding and investment. So let me hand it over to you now, Yashodhara Rana. You're the Director of Policy and Research at the Eleanor Crook Foundation, where you oversees ECF's portfolio on maternal and child nutrition. Your commitment also led you to engage with Power of Nutrition and the Maternal and Child Nutrition Journal. From your perspective and experience, how can nutrition stakeholders also support INI expansion?
Great. Thank you so much, Jan. And if we could get the slides up. Great. Good morning, good afternoon, everyone. Since I have limited time today, I will dive into the 4 things I'd like you to take away. First, next slide. We're excited about I&I not only because of the combined health impacts that Dr. Rebecca mentioned, but also because it may help improve the coverage and equity of both immunization and nutrition programs that a lot of the speakers mentioned. Next slide. As you can see in this slide, it's a bit blurry, but maybe we can share it after the webinar. There are several opportunities to integrate nutrition and immunizations starting from preconception. So multiple points where both services are provided or should be provided to families. And next slide. And where immunization programs have better coverage, nutrition programs can benefit by leveraging an existing platform. So here is just a sample of a few countries where the orange dots are the coverage of vitamin A supplementation, the blue dots are the measles coverage for the first dose. And as you can see, both of these services are provided at a similar point of life, but there is a big coverage gap. And this is one of the reasons also why our foundation is very excited about the opportunities and potential around I&I. Next slide. Which brings me to my second point, which is while there are strong logical reasons for integration, and as Ramadhani shared operationally, we can bring these 2 programs together, we should assess and implement the most cost-effective ways of integration to save more lives. For this reason, Gavi and ECF work together to explore what the literature can teach us. I encourage you to review this report as it consolidates the latest evidence, but most importantly also outlines a learning agenda. Next slide. Given limited time, I will touch on the 2 categories of integration illustrated in the report. In the left-hand side, you'll see combined service provision, or what I simply call as supply-side I&I, where immunization and nutrition services can be co-located, they can be delivered together, potentially by the same health worker. And the logic here is around efficiency, that it might be possible to use time and resources more efficiently for both the health system and the families. However, operationally, this success depends on these 2 services being very compatible. So if they're overlapping target age groups, or they have similar time to administer, among other things. On the right-hand side is the second type, which is enhanced demand generation and case finding, or you can see it as demand-side I&I. And here the rationale is about reach. That is, by having the same health worker promoting immunization and nutrition behaviors together, demand and utilization for both services can be increased more efficiently and effectively than if they were to be conducted separately. This can also include using the strength of one program to drive the utilization of the other. Which brings me to my third point. Next slide. We need to pilot and assess innovative ways of integrating immunization and nutrition programs that are both cost-effective and efficient. So in some countries, vaccine supply or a lack of health services can cause low immunization rates. But in others, the greatest challenge can be demand. So for this reason, ECF and Gavi, we funded NutriVax, so nutrition and vaccination, NutriVax, a randomized control trial in northern Nigeria to test whether providing nutrition supplements can act as an incentive for vaccination. Again, here the logic is getting vaccinated may not always be the most appealing option. And so if we want to see that if a nutrition supplement can function to incentivize families to come to health facilities. Very briefly, for those who don't know about SQLNS, these are food-based supplements designed specifically for the prevention of malnutrition in children 6 to 24 months of age. And recent analyses have shown that these supplements, when taken in the recommended dose, can reduce the risk of mortality by up to 27% and also have an impact on anemia, wasting, and stunting. So while we expect that this integrated program will continue to contribute to both immunization and nutrition efforts, this impact hasn't been rigorously proven to date, which is why more research would enable us to assess both the size of the impact relative to the cost. And both dimensions are critical components that policymakers need towards scale-up. Similar to NutriVax, we need continued investments in innovative approaches. Our partnership with, as mentioned by Augustin's team, has been key in this, and we would like others to also join in similar efforts. Next slide. Which brings me to my final point, which is that given the recent massive ODA cuts globally, this is the time to invest better and smarter. At ECF, we're fully supportive of a strengthened primary healthcare approach, in which the coverage of high-impact, cost-effective interventions like nutrition and immunization should be seen as markers of the health system doing its job. INI is not a standalone effort, but should be seen as a model for broader health service integration that is compatible and reinforces system-wide resilience and sustainability. In closing, I'd like to share what Dr. Sania Nishtar passionately urged the audience at the recent World Health Assembly side event on INI last year, which is to think about from the perspective of a mother coming into a facility with a sick child, looking for both nutrition services and protection from deadly diseases. When we work in fragmented ways, we fail to provide that to her. To this end, we look forward to working with you all, bilaterals and multilaterals, to take the evidence from pilot stages to being a core part of any health system strengthening efforts. Thank you.
Thank you very much, Yashodhara. Really insightful. And now, as our final speaker, let me introduce Maria Kahema. You're a midwife at Tumbi Regional Referral Hospital in Pwani, in Tanzania, and a former district coordinator for reproductive and child health for the Kibaha district. You also serve as a deputy treasurer at the Tanzania Midwives Association. You worked for the Village Health Day in Pwani, a platform integrating primary healthcare services. You have witnessed the benefits of integrating especially nutrition and immunization services to improve women and newborn health. Can you tell us about the benefits for the patients of these approaches?
Thank you. Good evening, everyone. As you said, I'm Maria Kahema, a midwife from Pwani. As we all know that vaccination, nutrition and vaccination are closely linked. Vaccination may not trigger strong immunity in children who were malnourished. Yet children with poor nutrition tend to be most vulnerable to infectious diseases and need protection from vaccine. Often the children that specialized immunization programs are trying to reach are also the least likely to have access to food and nutrition services. As I explained that before, our innovation in our district council, by then, we recognized that the need of integration of immunization and nutrition, since we know not all majority children reach the RCH services. So what we did, we selected just 4 wards with a population of 2,000 people. What we did, we just innovated on integrating those services to be done in their respective areas. Then we called to implement in quarterly basis, whereby all pregnant women and lactating mothers were jointly together. During vaccination, we provided health education concerning nutrition, and we went far more by demonstrating how to prepare a nourishable porridge to under 5 children. We went with some materials where we demonstrated various nutritious foods which can be prepared with their caretakers regarding or in their respective areas. Those interventions worked well, but when we go far, we saw that there is an increase of attendance of children receiving immunization. And again, we just introduced it to other partners to see the needs of integrating funds so that we can implement it in other areas in respective Coffee or Korean Foundation, where they saw the need of integrating those activities, whereby they expanded by providing some financial support, some other 5 ones to implement those activities. To me, as a midwife, immunization is a key to improve the child health. But when we integrate with the nutrition, we all know that only vaccination cannot eliminate malnutrition. But when we integrate immunization and vaccination, we can boost the immunity of children. And this is RSH is an avenue to integrate immunization and nutrition, since as a midwife, we used to screen those children who are coming to take vaccination. So we take weighing, we do anthropometric measurement, MUAC, to know the progress of the growth of the child. After that, we identify those who are malnourished or who are not striving well. We recognize and referring to a nutrition officer so that they can get proper counseling on nutrition. To me, I can say that integration of immunization and nutrition is a key area to put more effort so that we can reach more population, and with the limited resource we can hit 2 important issues, as we can make sure that immunization coverage goes together with the nutrition so that the child can strive very well. When I come back with the Village Health Day, we integrated by ourselves as government, but we involve other partners regarding with their interest, like, as I said before, Korean Foundation, they were interested on improving maternal and child health. So when we sent our proposal to integrate those, they were ready to participate with us, and they contributed some of amount to make sure that this program went well. So when we come for sustainability, we advocated some local leaders to make sure that they can integrate their budget, the annual budget, to make sure that this intervention, especially to those remote areas, can be implemented at least in quarterly basis as outreach services. By doing so, we can reach out to a high population of children who maybe sometimes can be missed because of maybe distance from their location to the facility. But by integrating, we can provide immunization and the nutrition can go together. These activities can be implemented under this program, improve the children's health indicators. Importantly, child health become permanent agenda in the community development activities. Also, government, MESI, and the political leaders were regularly updated on the health status of children in their communities of respective catchment area. Currently, the village health days are no longer being practiced in the communities or village in Tanzania, but in Kibaha DC, we revitalized that village health day on 2015. That's we started in a small area, but from now it makes some difference of improving of child health in our catchment area. Regarding the call for success of the Nutrition for Growth Summit and the Gavi,
Well, it seems that we have a connections problem with Tanzania.
in Tanzania and other areas. Thank you.
Thank you very much, Maria. We can see that your dedication to child and maternal health has made you a strong advocate for not only integrated health services, but also to the success of the N4G and the Gavi replenishment. Looking at the chat and the remaining time, from the questions we received, I will now turn back over to you, Augustin, since we have David Munganga from Médecins Sans Frontières, who has questions about the matching fund. How is it functioning? Who is providing the top-up, and who is beneficiaries of this matching fund?
Great, thank you. I'm very happy to talk a little more about the matching fund. So the matching fund is a simple incentive mechanism that doubles financial contributions from private sector funders. So it may be philanthropic funders, it may be corporate funders, and those contributions are either pure cash contributions that go into our regular vaccine program, or they are supporting more programmatic proposals, such as the INI proposal. So all our immunization, nutrition integration agenda is funded through the matching fund, with funding that came from a number of different philanthropies, and each time was doubled by the matching fund and implemented, with governments and different, partners, whether it could be UNICEF and GSI, and we and all kinds of different partners. So that's how the matching fund works, and any partner that has a source of co-funding and that has a project which is aligned with our strategic priorities, and INI is one of them, and it needs to be complementary to what we do, open up a new learning area, or address some particular gaps that we have in that space, can apply to the matching fund funding. We need to see if there is buy-in for this in the country. We work, all our work is country-led, so if there is buy-in for this in the countries where we work, then we have a review process, and we can propose the project to the review process.
Thank you very much, Augustin. Next question for you, Ramadhani. Issei is asking us, according to you, how can we convince ministries of health and local officials to better integrate nutrition and vaccination services?
Thank you very much. I think just to keep it brief, I think one thing that has been helpful for us is the use of evidence. So we were able to point out data from the national surveys that have shown consistently the coverage of the essential services for children has remained low, suboptimal. This is the coverage through routine services. For most essential services, below 50%, unless you step in with campaigns and so forth, it's very hard to meet the target. So I think that is critical. But I think the second thing, and again, speaking about data, is not just to show the low coverages, but also to show those discrepancies, like the data that Yoshi has shown, where you could see that the coverage for this, for vitamin A, let's say, and for immunization for the same children being different, then you could show how and what can be gained when we integrate. So I think use of data in that sense makes it easier to speak with the programmatic technical people from the ministries. The second thing, I think, is more of these financial instruments that supports these programs, because for us, the opportunity to match fund the Child Nutrition Fund, the CIF, and the Gavi kind of now makes it even more easier to bring in the two teams, the immunization program and the nutrition team, and really now to start to talk together on how can we implement both programs in a way that kind of is synergistic to reach these children. Obviously, it requires also a bit of advocacy at a higher level, up to the level of the ministry when the ministry is convinced. And this is how we started having slowly doing it with an integrated campaign. Whenever we had campaign for measles, for example, would include nutrition, and then it's easy to show the gains and then to kind of attract more interest or as an incentive on how can we program better in a systematic way going forward for these in a form of a nexus. So I'll stop up here, but I think data is really critical and financial instruments are helpful. Thank you.
Back to data, evidence-based approaches and science. What a great way to close the loop. Thank you very much, Ramadhani. Thank you all, dear panelists, for sharing your experience and opinions about the integration of nutrition and immunization. To summarize, I would say that this integration offers great promises on multiple fronts for global health. It could not only improve nutrition, but also incentivize vaccination, potentially leading to a significant reduction in childhood mortality. Its cost-effectiveness aspect is another positive argument in the current context where resources are scarce and crises intensify. As the minister said in introduction, the Nutrition for Growth Summit and the Gavi upcoming replenishment are key opportunities. We hope that government, private actors, and development partners will commit to the success of both of these events and accelerate the fight for nutrition and vaccinations. Today's conversation showed that the two can mutually benefit one another through integration, but more resources are now needed if we truly want to reach the targets that were set by the SDGs. Several events dedicated to integration will take place during the N4G summit. I know there were other questions in the chat that, mindful of timing, we couldn't keep up, but make sure to stay tuned to the subject to pursue this path forward. With that being said, I want now to thank you all very much for your participation and attendance, and wish you a good end of day. Bye.
Thank you.
Thanks so much.
Thank you.
Thank you very much.